Hi everyone, I'm Dr. Tan Yi Ping, consultant obstetrician and gynecologist. So this topic about ovulation bleed. Number one, simple things, infection. Infection of the cavity of the uterus. Sometimes inside the uterus is infected. So when we look at you outside, you're normal. Scan everything normal. And then when we do a pap smear, also normal. Because pap smear is outside ma. It's not in the cavity of the uterus, okay? So when you do pap smear, we only see this part, the vagina and the cervix. We don't see the cavity. So if you have infection of the cavity, we won't be able to know. So everything looks normal. Then when we do a hysteroscopy, where we scope inside, where we put a camera inside, then only we can see. Number two, what else? Other than infection, polyps, endometrial polyps. So polyps in the cavity, it can be quite worrying because all uterus cancer start from polyp. I never say all polyp become cancer. It's all cancer start from polyp. So if you have polyp, you wouldn't want to keep it, right? Because it's potentially cancerous. Polyp is one. Fibroid is another one. Small fibroids in the cavity. So we can have fibroids everywhere. Yeah? Okay, so when you have a fibroid inside, you can have fibroid outside, you can have fibroid inside. So when you have fibroid inside, you can also have ovulation bleeding or intermenstrual bleeding. Last of all is what I mentioned a couple of weeks ago on isthmocele. Bleeding from your Caesar scar. So it's bleeding from a Caesar scar. So you have no growth, but you have a scar that didn't heal well, and that is why it bleeds. Tell me that you have ovulation bleeding every month. Every month for the past 6 months, for the past 1 year, for the past 3 years. So first I will scan from your tummy, yes. If I don't see anything, I do a vaginal ultrasound and see if I see something. If I don't see anything, then I will do a saline sonography. If I still don't see anything, then I will do a hysteroscope. You go all out, you eventually find something. Because I have cases like this where everything we do normal, then finally I did a hysteroscope. Oh, there it is looking out. I cannot just say, it's okay, I live with it and ovulation bleed is normal, because it can potentially be cancerous. So we need to look for the ovulation bleed. Why you are bleeding? So when we're looking, we know all infection, then give you antibiotic. Of course, that one no risk lah. But then when I got polyp, then I'm worried, I must remove it. Of course, if I scan and I see it's fibroid, then I may, most likely I will still remove it, because fibroid also not supposed to bleed like this lah. Fibroid can also turn cancer. Fibroid who bleed is better, don't keep. Tend to give problem also, okay? Ovulation bleeding and intermenstrual bleeding is potentially cancerous. So you live with this bleeding every month for the rest of your life. What if one day you're really going to have cancer? How? If you think that it's due to the Caesar scar, you're not going to give birth anymore, you're not going to get pregnant anymore, you just let it be. But if you live with it, then it is an abnormal situation in your daily life. And what if one day you actually get cancer? So don't. Normally it's best to solve it, okay? So one thing is we worry about cancer. So that is why we need to do something, yeah? Another thing, what can it affect? Fertility law. You got infection in the cavity. Where do you expect the baby to go? When the egg and the sperm meet, it has to go into the cavity and implant somewhere, right? If it's so infected, it cannot implant, right? How to get pregnant? Am I right? Another thing is, if you have a polyp there, it is also obstructing. Where is this baby going to implant when there's something in the middle that's obstructing it? No place, right? Fibroid, same thing. You have a fibroid in the middle, so you don't get pregnant. Alright? Isthmocele also can affect fertility. You have previous Caesar, your gap wound open up, you bleed every month. It also make you cannot pregnant. So if you have ovulation bleeding or intermenstrual bleeding and you cannot get pregnant, now you know why lah. So you need to solve the problem. If you don't solve it, then how to get pregnant? Am I right? So these are the two things that you need to think about when you have this type of symptoms. Because number one, we worry about cancer. Number 2, we worry you cannot get pregnant. So you need to get it sorted out. You need to find it. So if you have intermenstrual bleeding or ovulation bleeding and scan and doctor say you are normal, then you need to ask yourself, have you done a vaginal scan? Have you done a saline sonography? Have you done a hysteroscope? If not, then it's not normal until proven otherwise. Yeah, you never look hard enough for it yet. They don't let abnormality become normal. So remember, yeah, any questions you want me to talk about, please put it in the comment section. Thank you very much and bye-bye.